All right. When it comes to Braxton Hicks contraction, right? You feel your belly tighten. It feels uncomfortable. Sometimes it's painful. Sometimes even scary, right? And almost every pregnant woman at some point will ask the question: Is this labor, or am I just imagining things? Well, that's why you are here tonight. So your mind should stop racing. Stephen is here. Your mind should stop racing. Is the baby coming now? That's the question they ask. Am I too early? Should I rush to the hospital? What if I ignore and it's real? This confusion is completely normal, my dear. It's completely normal. That's because the body generally would have to practice the real event, or rather practice for the real event before it happens. And those practice contractions is what you want to call Braxton Hicks contraction. What I just said now is the whole 45 minutes gist in one sentence, right? But let's give details so that we'll leave nobody in doubt. Let's give details. If you're just joining, make sure you're following me. Make sure you're following me, you're sharing the live and tapping on your screen. If I see the tabs stop coming up, I may just have to stop also because it's important we give people opportunities. Is that okay? All right. So let's go now and understand the difference between this Braxton Hicks and labor and solve all the confusion that will cause you fear. Hey, Stephen, how's it going? Good to see you. Compliment. Right? So before we go into the depths of it, we want to look at what contractions generally, what they really are. What are contractions really? Utonwa, have I seen you before? Is it your first time here? Talk to me. I'm not sure, but I'm trying to pick people's name and remember them, right? So talk to me. Have I seen you before? Oh, okay, I've not seen. This is your first time. Okay, okay, all right. I want to make sure I know everybody that joins me, right? I hope you are following me. You should follow me. Anyway, what are contractions? Who is this? You want to say talk, 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 talk. Stop greeting people, right? Ashley series. Stop greeting anybody. Just go ahead and start talking. But you want to speak to me? Okay. When it's time for question and answers, you will come up. Or if you want privately, but privately you need to pay me. But you can speak to me publicly. All right. So since Ashley said don't talk, don't greet anybody, just go straight to the gist. So we'll go straight to the gist. All right. If you have anything to say, just wait. We have interaction section after giving the details. Is that okay? But I need you to tap on your screen. I need you to tap on your screen. Right. All right. Before Ashley begin to harass me again. Yeah. What are contractions? What contractions really are? Uh, Dr. Pat, are you here? That question is the question on the is for you. You may want to give attention to that. Right? All right. So a contraction is when the uterus tightens and relax, right? Tightens and relax. That's what contraction is. It tightens and it relax, right? And remember that your uterus is a muscle, right? What is a muscle without contraction? Is that not so? Remember when we're talking about the uterus proper, we talked about that normal rhythmic contraction that happens, right? Remember? Anyway, the uterus is a muscle, and like every other muscle, it must train before doing any heavy duty. any heavy work, right? So you don't ever think the uterus is just there dormant. It has to train for the big job, and childbirth is the hardest work that the uterus will ever do. The hardest work is childbirth. Good evening, Jennifer. Welcome. Right. So what nature does, nature designed it in a way that it has a training system for the uterus. So the same way we go to the gym to get V chest as guys, your uterus is also practicing. It's practicing. So that when the big day comes, all the energy needed, all the strength needed to get the job done would have been very much available, right? And that training is actually Braxton Hicks contraction. Is that not simple and interesting enough? If you understood what I just said, just talk to me in the comment section. Understood. That's the simplest way to describe Braxton Hicks, right? So if you understood what I just said, just type in the comment section. Understood. Okay, was Jane. Thank you. I'm always looking for that one person who understands what I'm saying. That is my joy. All right, so now let's give details of this Braxton Hicks contraction. I always tell you guys, Oyibo people, they are very wonderful. What South Africans call Masungu, right? They are very wonderful people. They like putting their name on things, right? You not blame them. A person will get mouth, 9 day fish out pass for room. So they like putting their name. So that is actually somebody's name, right? So what are Braxton Hicks contraction? And like I said earlier, Braxton Hicks contraction, they are actually practice contractions, right? They 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 prepare the uterus for labor. Is that okay? Prepare the uterus for labor. And besides preparing the uterus for labor as per Jimmy before labor, they also improve blood flow to the placenta. That's another benefit of that and why it must happen. Then it helps tone the uterine muscle, right? It helps tone it, the uterine muscles. And it also helps the baby to move into position, right? That's like um, when you carry something in plate that is not in proper position, you shake it a little, then it arranges itself into position. So that's just basic idea why that must happen. They are not dangerous. Braxton Hicks contractions are not dangerous, and they are not a sign of labor starting, even though it can be confused for labor, right? So when does Braxton Hicks contraction start? Is somebody with me here? Okay, our live goal has ended. Is there somebody with me? If you are still here, see I'm here. Just communicate with me in the comment section. I want to see and be able to remember you. Please tap on your screen. Let's tap on your screen. Don't play with this tapping on the screen, because that is the only thing you can do for other people to come and learn, right? All right. Okay. So when do Braxton Hicks start? When does it start? Right? Well. Some women, rather, most women start feeling these contractions around 20 to 24 weeks. Right? But they become more noticeable in your third trimester. The reason why I'm talking about it now, because we are done with second trimester. Right? So we are in third trimester proper. So most cases is more noticeable in the third trimester. In fact, some women feel them early, while some barely would even notice them at all. So we are not saying that it must happen for everybody, but regardless, whether you notice it or not, it must serve its purpose, and all that is normal. Hello, sweet. So what does it feel like when Braxton Hicks starts? What does it feel like? Some women would describe Braxton Hicks as tightening of the belly, hardening of the abdomen, even mild cramping, you know, pressure without pain. Crystal label is here, right? That is the way it has been described. The belly may feel like a hard ball for few seconds, then it relaxes. Understood? Yeah. And how long do they last when they come? Few seconds, I said. But again, usually you have a bracket, a duration bracket of 30 seconds, sorry, to 1 minute. And it's not regular. The contraction is not a regular contraction, right? It does not have a pattern. It just come and go randomly, right? So these are the characteristics of this Braxton Hicks contraction, so that when you begin to feel it, you know exactly what you're feeling and when to start being afraid and when not to start being afraid, right? Good. I haven't said all that characteristics. What triggers Braxton Hicks contraction? Waiting the cause am, right? Should I fire on or I should wait for people to tap? They've stopped tapping, so maybe I should just wait for a few seconds. Please, all fingers on the screen. Let's tap. Let's tap. Let's hit 20K likes. Is that okay? Hello, Rita Rizzy Love. I see you. Boss Jane. People are not tapping now, so what are we going to do? It would be selfish to fire on, and people have not come because I want everybody to learn so that, in fact, if you if you learn enough, your fear will be reduced, right? Essie, thank you for the follow. Please, let's keep taking the likes up. Let's hit 20K likes. All right. So, what triggers Braxton Hicks? That is what I want to talk about. But I want us to tap on our screen. For those who are just joining, please make sure you're following me. It's wise to do so. It's wise to do so. And after this discussion, you can send your request. Come up, ask your questions. All right. Ask your questions. Then make sure you go and see your doctor, right? We can only guide you from here, but you go and see your doctor, right? Wherever you are, go and see your doctor. Even those that are close in the city, the same city as me, I usually ask them to go and see their doctor. Why? Because even me want to rest. Nasi is here. Good to see you. All right, are we ready to go now? Are we ready to go? Okay, so we are targeting 20K likes, but I will continue. But if the likes stop, I'm going to stop also. Is that okay? Boss lady has come. All right, what triggers Braxton Hicks contraction? If you are just joining, I've explained what Braxton Hicks contraction is in the simplest possible term. So you want to stick around. Maybe when I do a recap, you will understand better. But what triggers Braxton Hicks? They often happen when, please, this is the time to write something down, because if you don't write it down, you may forget the details. So grab your pen and paper. Make sure you're sitting in a very comfortable position so that you can write something. So Braxton Hicks is usually triggered by, number one, dehydration. Number two, for some who have been working or have been active, it can it can trigger Braxton Hicks contraction. Hello, sunflower. Welcome. Sexual intercourse can trigger it. Sexual intercourse, right? They knock with your big belly. It can trigger it. Right. So number what are we now? Number what are we now? Let me see how many people are with us. Is it that the network is slow? That be smart. Narcology is the way to go. So sexual intercourse can trigger it. So we are in number 4 now. Yeah, thank you. When your bladder is full, it can also trigger Braxton Hicks contraction. Ẹ̀yin ojú Elédùmarè, I see you're welcome. Right? When your bladder is full, it can trigger Braxton Hicks contraction. Even the baby moving suddenly can trigger Braxton Hicks contraction, right? However, they often stop when you change position, when you hydrate, that's take some water, when you lie down and rest, it will stop. Remember, Braxton Hicks is actually not a true labor. So when you make some adjustments, they will stop. Is that okay? If you understood up to this point, please talk in the comment section understood, so that I will know that you are there. All right. Okay. If you are just joining, you are not following me, it is smart for you to follow me. Follow me, tap on your screen, share the live. And if you've not dropped a heart me, one coin, drop it now. And show us that you appreciate what you're learning. Is that okay? All right. Let's go to the next thing. Thank you for the hearts, me, Christy. Sunflower says she has no idea whatsoever what we are talking about. Okay. So look at my screen. If you want me to repeat, you can go to my screen and touch any of those options. Then I can go back and repeat for you. Is that okay? Otherwise, you wait for the short recap. Is that okay? I want to, but cannot. But okay, just do your best. But if you're not following me, it's important, because a day will come, I will restrict the live stream to only maybe fan club or subscribers. So it's better to follow me now, so that you can always be updated on what's going on, right? Bloom Beauty is here. Now, if you understood everything I've said about Braxton Hicks contraction, if you have, now let us talk about true labor. Just small idea. The whole idea is to compare Braxton Hicks contraction with true labor, so that you know how to manage your fear. Right? Can we fire on, or we should wait for people to tap? We are supposed to hit 20k likes. So should we wait, or we should fire on? Wherever you're joining me from around the world, you want to make sure you tap on your screen, share the live, follow me. Also, make sure you have a pen and paper and learn a thing or two you may not have known. Right? So let's tap on our screen. Okay. So what is true labor? Like who said, somebody mentioned that thing now on the comment section. So when labor starts, body go tell you, right? Because true labor is the real deal. Oh boy. Sunflower, don't worry. There's no hopeless situation with us in this platform. Don't worry. People already have testimony, so just maintain a positive mindset. You'll be fine. And come up to ask your question if you have any when it's time, right? When it's time. There's no hopeless situation. It's just knowledge that you need. And also ability to accept the brutal truth. Uh-huh. Is that okay? So what I was saying was labor is the real deal. Oh boy. It means um your cervix is opening. It means your body is preparing for birth. It means the baby is on the way. Right? Oh, is that not wonderful? True labor contraction can cause cervical change. I will not go into those details. I will not go into those details, but again, that change is actually the key difference. Is that okay? So, what does true labor feel like? For those who already have kids, who already have gone through the labor, um, had labor one or two times, they already know what it is. In fact, I think locally here, there's something uh, mothers will say. They'll call it favor room, not labor room, right? So, what does labor feel like? What does labor feel like? True labor contractions are strong. They are more painful. They are more regular. They are closer together. The contractions are closer together, unlike the random contractions you have when you have Braxton Hicks contractions, right? They're more closer together and long lasting when it comes. Long lasting. The pain usually will start in the lower back, right? Radiate, wrap around to the front, and move like waves. Oh boy! If you've never been to the labor ward before, you will not understand. Even men cannot explain this part, but we can only study it and tell you what's going on. Is that okay? So it starts from the lower back. For those caring men who have always been there when their wife is about to go into labor, one of the first set of things that you will notice in the complaint will be lower back pain. In fact, you will rub that lower back tire. Rub my back, rub my back, rub my back. That is the place. You go rub that place tire. Why? Because it starts at the lower back, right? Wrap around to the front. Then move in waves, right? Don't worry, you experience it. You experience it. So many women describe this as um, tightening that builds, that tightening that begin to build, then peak at a point, then releases. That is the wave I was talking about. The tightening will build, peaks at a point, you will shout, you go shout, then it releases. It happens again and again and again, right? Oh boy. Anyway, just to give us a perspective, true labor contraction comes at regular interval, and it gets closer together every 10 minutes, then 5 minutes, then 3 minutes, right? When that contraction holds, it's long lasting. They last long rather. For 30 seconds, 60 seconds, 90 seconds. It gets stronger over time as you are getting closer and closer and closer. Of course, I'm not going to talk about the the dilatation and all that. Leave that to your midwives to worry about. But just to give you an idea what's going on, right? So these contractions, they do not go away with rest. Just in Braxton Hicks contraction, when you change position, rest, it can go away. Even if you are dehydrated and you have Braxton Hicks contraction, if you hydrate, it can go away. But labor contraction does not go away. It does not go away. It stays there. Whether you are hydrating, whether you are resting, the contraction will hammer you, right? So the difference between the Braxton Hicks contraction and the true labor, the true labor is regular. Yeah, Braxton Hicks is not regular. Um, True labor gets stronger as it progresses. Braxton Hicks does not get stronger, right? When it comes to pain, true labor is painful. It's painful. Braxton Hicks contraction is just or mild pain or some level of discomfort, right? Which is different from true labor. True labor is painful. If it's not painful, why are they shouting? In fact, I think the Fulani people, those in Nigeria, I don't know about other parts of the world, the Fulani people are the only women I've seen all these years. Now, the Fulani and Hausa, some Hausa actually, they're the only women I've seen all these years who do not shout at labor. I think there's something in their culture that make it so. I don't know. So if you are Fulani from any part of the world, please confirm to me is the same in your country, or you want to tell us about the culture that makes Fulani women not to shout during labor. You want to help me understand. Amma, you want to help us understand that? Send me a request. Let's know. Is there something in your culture, right? Is there something that happens to people, or is a stigma that comes with shouting during labor? Anyway, while we're waiting for Hammer to decide to come up or not, so when it comes to pain, Braxton Hicks contraction is just mild pain or some level of discomfort, right? While labor pain is very painful, right? I haven't experienced that. I've said to myself, I will never escort anybody that I know to the labor ward again, because it's our mother say if you shout during your first child, that's how we continue. And also, okay, let's continue hearing from you. Okay, I think it's a cultural thing that is passed down, right? So let's continue hearing from Amma Ishak. Like I was saying, I said I will not escort anybody to the labor ward again because the last time I did, I suffered. Me that was not on labor, I sweat past the person where they labor. And if you are a man and you are following your wife to the labor ward for the first time, you go cry, unless it's very rare not to see somebody that cries. That is if you love the woman, sure. But if you consider it to be a way to flog her for all the Ashinogri word before, okay, it's good for you. All right, so I said that it's painful. When it comes to whether the pain or the contraction will stop with rest, labor pain does not stop with rest. Labor has started, it has started. Whether you want to rest or you want to be running all over the place, the contraction will be there. That is labor. But Braxton Hicks contraction, yes, when you rest, rehydrate, right? It can relieve you. Why? Because it's not true labor. In true labor, the cervix opens, right? But Braxton Hicks contraction, the cervix does not open. There's no need for it to open. And Braxton Hicks contraction does not lead to birth, but labor does. Because the whole purpose of labor is for the baby to come out. And that's why the whole contraction must happen and progressively become stronger, right? As you make progress. Right? So there's the difference between the both of them. Now, when we started earlier, I told you that Braxton Hicks contraction is the uterus way of practicing contraction before labor. More like the uterus will have to do gymming first in preparation for labor. Even though that gymming will lead a lot of first time mothers to the hospital 1 million times. So, doctor, I'm feeling contraction. It's not contraction, go home. They'll go and come back tomorrow. Doctor, I'm feeling contraction. It's not contraction, go home. So why? Because it's a first experience and stuff. So you will not blame them. You will not blame them. Is that okay? So your uterus, like I said, is actually preparing. Use the Braxton Hicks is just a way of preparing for the marathon of labor, right? So Braxton Hicks improves the uterine muscle tone. Very important. It improves the uterine muscle tone. Braxton Hicks. Let me stop this. Look for a way to stop it. I want to stop this viewer's wish that is on the screen. Okay. All right. So it improves the uterine muscle tone. It improves blood flow to the placenta. Right? It also helps the baby to settle in position. Yeah. And it's just nature's way of making sure that everything is all right before the baby, before the real labor starts, right? And it prepares the cervix gradually before the long drama. What happens when baby gets a long infection? Which baby? The one in the womb or the one outside the womb? Right? Just see your doctor, they will treat your baby. Is that okay? So, long story short, Braxton Hicks contraction is a nature's way of making your uterus rehearse before labor starts. If you remember it this way, if you can understand it this way, you always remember, right? You always remember. So those of you asking questions, please tap on your screen, share the live. We need to hit 20k likes. Tap on your screen, share the live, and also hold on with your questions. We'll take questions the moment we are done with this Braxton Hicks contraction discussion. Is that okay? That's a smart thing to do. Home Ajoke is here. So when should you worry? This my wish has stopped to has refused to stop. Okay. So when should you worry? When to worry? When should you worry? Remember that not all pain is a normal pain. So whether it's a Braxton Hicks in disguise or it's not Braxton Hicks, always feel concerned. But when should you worry? Right? You should seek your medical help, whether I call your matron, your nurse, or your doctor, immediately if you are having contractions that are regular and painful before 37 weeks. Contractions that are regular and painful before 37 weeks. Call your doctor. If you're having these contractions and there is vaginal bleeding, you don't want to sit at home. You don't want to sit at home. Good evening, Amma. Amma, good to see you. Right? If you are having the contractions and you are having vaginal bleeding, don't sit at home. Go and see your doctor. When the water breaks, it's time to worry. Rush, rush, rush. Go and see your doctor. If for any reason you notice, remember we talked about baby kicks, right? Quickening the other time. Good. So if for any reason the baby movement reduces, don't sit at home, right? Don't sit at home. Go and see your doctor. If you have severe abdominal pain that does not go away, you have this pain and the pain is just not going away, go and see your doctor. And you see fever or foul smelling discharge, go and see your doctor. You should be worried. Go and see your doctor. Is that okay? So that's when you should be worried, because all these I just mentioned now could be an indication of preterm labor. It could be an indication of placenta issues. It could be an indication of infection. So you want to see your doctor, they will do the needful and advise you accordingly, right? Advise you accordingly. But so back to Braxton Hicks contractions. What about vomiting? What happened to vomiting? Right? You were here when we were talking about morning sickness in the first trimester and second trimester, and I told you that there are some people that will feel this, some, not everybody, that will have these symptoms up until they deliver. So you want to put that in perspective, right? So having said all this, how do we now ease Braxton Hicks contraction at home if necessary? I told you when to see your doctor already, so put that in your diary. So you want to try drinking water, because hydration, or rather dehydration, is one of the cause of Braxton Hicks. Yeah, it's one of the cause of Braxton Hicks. You're already closed now. Go and deliver Mukucho price. Why are you causing more confusion? So you can ease Braxton Hicks by hydrating, taking water, changing your position, right? Changing your position. You can lie on your left side. You can take warm shower. It also can ease. And I wish men are here. I know they're watching football, but I wish they are here so that they also can help manage the situation when it happens. You can take warm shower, breathe slowly, right? And also empty your bladder. So for those who have been here when we started, you see all the causes of Braxton Hicks. So you want to do this, it will mitigate the Braxton Hicks contraction. Osborne Blessing, thank you very much. I see. All right, if you are just joining, you're welcome. Chris is here. Good evening, Sugarberry. If you're just joining, you're welcome. If you have not followed me, this is the time to follow me. Please tap on your screen. Let's tap on our screen and give more people the opportunity to come in and learn something. You've not followed me, this is the time to follow me. You've not dropped a heart me, this is the time to drop a heart me. At least all this wonderful information. Heart me is just a show of appreciation. Thank you. And heart me is just one coin. Is that okay? So that will make sense. It will be smart to do so. But make sure you're tapping it on your screen and also give other people opportunity to learn. Right? And also don't forget our New Year special edition. MSEG is here. Don't forget our New Year special edition. Oh boy. It's designed for men. Men, that topic is for you. But I know that I'll still have more women, but nonetheless, you can come and learn for your spouse. Is that okay? So the special edition is on recovery time in intercourse. Why some men can go 20 rounds, some can go 5 rounds, some can do 1 round, and some cannot even complete half rounds. So we'll look at that and look at all the factors that can cause all these, and also advice on what should be done. I'm telling you, you don't want to miss that episode for anything. Alma, you need to see your doctor, right? You need to see your doctor. That will be a function of your history. Is that okay? Good evening, Chi Interior. I see you. You're welcome. Is that okay? So as we are beginning to round up, I want to give more time to people who want to ask questions today. So prepare your question. Prepare your questions. And when it's time, just send a request to come up. We will bring you up for you to ask your question. Right? So remember when we're talking about some issues around the second trimester, and one of the things we found out is that women can be afraid sometimes for nothing. But again, that's what pregnancy does. Even though it's for nothing, it's called protective fear, and that's very essential, right, for the pregnancy. So it may be for nothing, but it's protective. But the emotional side of this Braxton Hicks concern, why women actually panic. Many women fear the kind of question they have in their mind is, what if I go to the hospital and it's too early? That may be your case. What if I ignore the real labor? Right? What if something is wrong with my baby? These are valid fears, and they are normal for you to have that kind of fear. But remember, um, hospitals will prefer false alarm over late arrival. You may want to draw your ear and take in this information very well. What did I say? Hospitals will prefer false alarm over late arrival. If it was this ear you draw before, draw this one. Hospitals prefer false alarm over late arrival. It is for your own good, right? It's better to come in and they say, oh, madam, go back, I beg. Now false alarm, now Braxton Hicks contraction. It's better than for you to have stayed and it's now too late. This outgoing year, there are several good cases we had, and there's some other cases that are not so good, right? One of the things that touched me the most is seeing somebody who would have carried pregnancy up to 40 weeks, and for some reason, the baby just stopped. The heartbeat just stopped. where do you begin to explain that kind of situation? Right? So your false alarm is better for us than you coming late. Right? Some would come and you just discover that this fetus has passed close to a week ago and they just didn't know. They just didn't know. Your false alarm is better than late arrival. If you did not hear anything today about pregnancy, hear this one, right? So if you're just joining, you're welcome. So don't think that when you are raising false alarm, you're actually wasting your doctor's time. It's better to waste his time than for us to record a demise. It's better, right? Even your doctor also wants to carry the baby. So it's better to waste his time with your false alarm than a demise. Is that okay? Lady G is here. So yesterday we talked about partner's role in in pregnancy, right? And the role continues up until delivery, right? We advise partners what to do, how to come in, how to douse the fear, right? But again, if you do not have that kind of supportive partner, don't worry. Lady G, good evening, good to see you. Don't worry. Don't worry. There is an adage in our local climes. Sorry. They say a cow that does not have tail. Now waiting. Let me see how many of us have heard that. I will not complete it. Those who knows the adage should please complete it for us. Right? So a supportive partner would actually stay calm and help you through the process. Right? Even with your false alarm. If supportive partner will be a supportive partner. And we always encourage that. Right? Nose la pepe la hot. Yeah, yeah, you're with me. Yeah. So a cow that does not have tail is God that drives fly. So if you don't get a supportive partner, no worry. God go run now. And I said something the other time. One of the things, maybe the medics in the comment section will confirm. One of the things I've noticed over the years, you see those women that didn't have any support throughout their pregnancy, they need to ever get complaint. Even their shout needed too much. But those ones that have all the support, oh, they will shout the ceiling down. They will tear the whole place up. Yes, they have the ones without support. Usually, their own is smooth. It doesn't mean that you should not be supported. Though. Every woman should be supported. I've told you the things to do to make life easy for you. So just do what I told you. But one thing I observe is that those without support, their case is not usually hard. But those with too much support, even to lift the leg is a problem, right? Anyway, so I said the supportive partner will help you stay calm, and also will require them to also stay calm, because there was a certain man when the wife was inside the ward shouting her shout, right? Like they will say, when you go to labor ward, you shout your shout alone. But in this case, it was not so. While she was shouting in the labor ward, the husband is outside shouting, "Yeah, yeah, doctor, help my wife, help my wife." Oh boy. Yeah, right. So he's also in labor in the waiting room. That's beautiful. That's beautiful. Anyway, anyway, even in terms of contraction, if you have supportive partner, it helps you through by rubbing your back and all that, right? Even giving reassurance emotionally, and also when it comes to movement, mobility, right? Right. Tickers, what do you mean by hope you are safe? I don't know. Just wait. We're going to start taking questions in a few minutes. Please, let's take these likes up. Let's hit 40K likes. Okay. We're 20 now. That's for the 20K likes we just achieved. Let's hit 40K likes. Is that okay? Anyway, long story short, Braxton Hicks, they are not a problem. They're not a problem, really, right? They are a preparation. They're a preparation. True labor will make itself very clear. Yeah. And that is why I'm giving all the details tonight. The difference between Braxton Hicks and true labor. But one thing is sure, true labor will make itself very clear. Like somebody in the comment section mentioned earlier, when labor starts, your body will tell you. And guess what? Your body knows what to do. Your body knows what to do. All right. So do not overthink it. Just have knowledge, know what is what, and you are good to go. So long story short, Braxton Hicks is the uterus way of practicing for the labor, and it has all the other reasons why it has to happen. Besides practicing for labor, it also increases the muscle tone. It also um, helps the helps to move help for blood flow into the placenta and so on, and all those things we mentioned, right? Then true labor is a progressive uh, kind of pain and contraction, while Braxton Hicks is random. There's nothing progressive about it. It's just random. It comes here, go, comes there, go, and it's due to dehydration, sharp change, sharp movement of the baby, full bladder, and uncomfortable positions. Even intercourse can cause Braxton Hicks, right? When you come be say you dey knack waiting no good, then your wife come dey shout, the baby is coming, calm down, you already know. So, and the thing about the labor, true labor, is that it builds, right? It builds. It doesn't just suddenly come. It builds, right? But again, when you are in doubt of what is up with you, please go to your doctor. Go to your doctor. Anyway, with this few point of mine, I think I'm done for today. So if you have a question, please send your request. Come and ask your question now. Come and ask your question now. If you come to my DM, be sure that you're going to pay. It's not a big cash, just something small, just for you to appreciate what we are telling you. But when we are here, you can ask your question. You can't send what? What can't you send? I restricted you? How? How come? I don't know what you're saying. I've never restricted anybody. All right, send your request. Oh, it's not me. Oh. Okay, okay. I think I know why. I think I know why. It's the viewer's wish. Let me end it. Let me end the viewer's wish, then we can start taking questions. Let me end it. It's the viewer's wish that is causing it. All right, if you have a question, it's time for you to ask your questions. All right, you can now send your questions. You can now send your requests. I think it's open now.